morning. My name is Dr. Andrea Low. Today I will be demonstrating the examination of the hands and wrist. Mr. Au has kindly agreed to let us examine his hands. Good morning, Mr. Au.
Good morning.
So first of all, position the patient's hands comfortably on the pillow, like so. The examination of the hand is divided into 4 parts. Starting from the dorsum of the hand, look for muscle wasting of the intrinsic muscles of the hands. Observe for any skin changes of psoriatic plaques, redness, or thinning suggestive of corticosteroid use. Look carefully at the nails for any pitting or onycholysis suggestive of psoriatic changes. Observe the nail fold carefully for any nail fold telangiectasia. Look for deformities, scars, and swellings of the hands, and decide whether they are symmetrical or asymmetrical. Now ask the patient to turn his hands around. Can you please turn your hand around? On the palmar aspect, look for thenar and hypothenar eminence wasting, and a scar to suggest carpal tunnel release. Next, we move on to feel. Palpate bilaterally for the radial pulse. I shall move on to demonstrate the examination on one hand. The examination has been performed in both sides. Feel the thenar and hypothenar eminence for muscle bulk wasting. Test for sensation of the median nerve over the thumb palmar aspect and over the little finger. Please turn over. Testing the radial nerve over the dorsal first web. Observe for any skin changes over the forearm, wrist, and the metacarpophalangeal joint. Increased warmth suggests inflammation. Next, I want to do the metacarpophalangeal squeeze. I will be squeezing your hand and let me know if there's any pain, alright? Observing patient's facial expression. Is that alright? Next, palpating the finger joints, the metacarpophalangeal joint. Applying firm pressure with your thumb and supported by your index finger beneath. Let me know if there's any pain, right? For the proximal interphalangeal joint, testing for any fluctuance, and the distal interphalangeal joint. Now perform bimanual palpation of the wrist. Turn your hand around. I shall be performing the Tinel's test. This is a test for carpal tunnel syndrome. I'll be tapping the carpal tunnel here. Let me know, Mr. Au, if you feel any numbness or tingling in your fingers.
Okay.
All right? Do this for several seconds.
No.
And show me your elbow. Palpate and look for any ulnar border rheumatoid nodules or psoriatic plaques. Move on to movement. Mr. Au, can you extend the fingers like that? If a patient is unable to do that, that could be due to a dysfunction of the nerves, extensor tendons, or the joints. Okay, Mr. Au, make a fist. It's good. Okay. Show me your hands this way. Now, can you point your thumb upwards towards your nose? Keep it there, don't let me push your finger down. Good. Okay. And now, can you spread out your fingers? And again, don't let me push your fingers together. Good. Now, I want to test for active and passive movement of the wrist. Mr. Ao, can you do this for me? Flexion and hyperextension of the wrist. Good. Now perform the passive movement of the wrist joint. Let me know if you have any pain. Next section will be test of function. Mr. Ao, can you grip my fingers? As tight as you can. Good. Now I'd like you to pinch my fingertips. That's it. Good. Now can you please pick up the coin with your right hand and with your left hand. Thank you, Mr. Ao.
Welcome.
We have now completed the examination of the hand and wrist.